So I know that you've heard of seizures before, whether that be epilepsy or whatever, but have you heard of something called pseudo-seizures? Now, pseudo-seizures, when I very first heard that, I think of pseudo as in false seizures, meaning that they're not real. So actually, when I was a CNA, just like working in the hospital, I remember working one night in the ER. There was a patient that came in. She started having a seizure, what I thought was a seizure. And so I, of course, started getting a little bit of anxiety, like we need to get this patient back. And I was really concerned for her. But my nurse, he was working there and he said, no, that's definitely a pseudo-seizure. And so he, thinking that he was just more educated and knowing what he was doing, just decided that that patient could just suffer through it and just wait in the waiting room with all the rest of the patients. Now, everyone around was like really worried. There was other patients that were waiting in the ER and it was causing a scene. And I just remember thinking, this isn't okay. Like, what if it's a real seizure? And this whole time I just was feeling so bad, and I had no idea that pseudo-seizures are actually true, real seizures. It's just that the origin of the cause of it is different. It's a psychological versus neurological. It wasn't actually until I experienced a pseudo-seizure myself that I realized, okay, pseudo-seizures are really intense and they are definitely real. So that nurse that I was working with in the ER, and so many healthcare workers that work in the hospital, I just hope that I can help raise awareness, that we can all help raise awareness that pseudo-seizures are very, very real. Now, they are a little bit less dangerous because it's not a neurogenic seizure. There's not anything chemically that is going wrong in the brain. However, interestingly enough, the same medications that are used to be given to patients who are having an epileptic seizure versus a non-epileptic seizure or a pseudo-seizure, they're the same. So you have your CNS depressants, your central nervous system depressants. Now, these medications such as clonazepam, Ativan, they help to really calm down the nervous system. Now, interestingly enough, I was actually given clonazepam and Ativan for my pseudo-seizure and for a lot of other, panic disorders. So even though a non-epileptic seizure is not neurogenic based, it is still, acted up by the nervous system. So those same medications are used. Now, there's a few things there's more than a few things that went wrong with my situation in the ER with my nurse. So first of all, there was a huge stigma against pseudo-seizures, against mental health. Now, this person was being neglected care because they were considered a psychogenic patient, and because it wasn't technically an emergency, they weren't being taken back right away. However, I do disagree with this because as a patient, when you think that you are dying, when your loved one is experiencing this with you, it is very, very serious. In fact, when I had my pseudo-seizure, I was hyperventilating to the point where I was actually losing a lot of oxygen. My hands started to curl, my arms all of my limbs started to curl to the point that I could not even walk. And that in itself can be a medical emergency. When your blood pH is off, it's very, very scary. So first of all, of course, that stigma, first of all, is huge. We should never, never neglect care to patients because it is a psychogenic cause, because it is still an emergency for the patient and for the family members. And so this nurse, I hope, has learned by now that pseudo-seizures are very real in that sense. And also, secondary to that, there is no way to distinguish between a pseudo-seizure and an actual epileptic seizure. They are very, very similar in their symptoms. In fact, oftentimes epileptic seizures can be misdiagnosed. They can actually be pseudo-seizures. The only way to tell if it is an actual epileptic seizure is by getting an EEG, or an electroencephalogram. Now, I actually have gotten this before because we were concerned that I was having real seizures, real meaning, epileptic seizures. And so I actually, there's certain protocols that I had to go through where I couldn't be on any central nervous system depressants. I couldn't take any caffeine, the night before, all this stuff that may affect my nervous system. So they actually hooked me up to a bunch of sensors all over my head so that they can look at the brain waves that were occurring. During this test, they directed me to do, a few things. They directed me to try and sleep for a little bit, which I actually could not. I had been struggling with sleep at the time and was very, very anxious. So I wasn't able to quite do that, but they also had me hyperventilate for a little bit and just do certain types of breathing exercises with them during the test. And they would ask me, are you getting tingly limbs as we're doing this, things like that. And it's a very interesting, very advanced, extensive test that they did. And it took a couple days for them to get the results back. But once that they did, they came back and they said, you know what, you don't have any markers for having epilepsy. We didn't see any abnormal brain waves during the test. Now, even that it's hard to diagnose whether you're having an epileptic seizure or not, because if you're not actually experiencing symptoms during that test, they can't definitively say that. And so in my situation, I was not prescribed epileptic medications because I also had a history of panic disorder and things like that they just decided, let's give you PRN or as needed, some of these central nervous system depressants to help cope with these symptoms, but it wasn't indicative of me actually having an epileptic seizure. And so in my case, I never got to, I was never misdiagnosed with epilepsy, but I definitely got my fair share of experiencing pseudo-seizures. And also, it is very likely when you have conversion disorder, it is more likely that you will experience pseudo-seizures. So carrying on with the symptoms, we kind of all know the symptoms that you would experience during an epileptic seizure, which includes tremors, you'll have convulsions, jerking motions of the body. In my case, my limbs were flailing all about, and I was so scared. My heart was pounding, it was racing so fast, and I was just on the floor really thinking like I'm having a seizure right now, and I had never experienced that before. And we were all pretty scared, and I was like, take me to the ER because this is not okay, this is not normal. I truly believed I had epilepsy or whatever. And still to this day, I kind of wonder if it was a real seizure or not, but it's more likely that it was a pseudo-seizure that I experienced just because of all of my history, which you can read about in my blog and all that, but had quite the adventure with mental health illnesses. So pseudo-seizures are very, very real. They're not fun. Some people can go unconscious from them. Some people, you'll see them staring blankly out into the open, which is another type of seizure that there is, but they're the same symptoms. And so this nurse was wrong to say this person's having a pseudo-seizure because he was just able to read the past reports of this patient is labeled as psychiatric. And that in itself is another stigma that a lot of healthcare workers have, which it saddens me because being a healthcare provider myself, being a registered nurse, I'm grateful in a sense that I had these experiences because I'm able to empathize with patients who experience mental health disorders. And I'm sad at myself because I also used to have a stigma being a CNA in the hospital for 4 years before becoming a nurse. I worked with a lot of people who every time we got a patient who was psychiatric, we would just kind of roll our eyes a little bit because we didn't want to work with those patients. We just felt like their situations weren't valid, that they were loony, that they were crazy. And so becoming a patient myself, I was thinking, I'm crazy. I must be crazy because every time I would see patients like that, I would just label them as crazy. And so I truly believed that I myself was crazy when I was experiencing these things, and that when I went to seek help, that I knew everyone else was thinking that I was crazy. And that is just so, so sad. I've had horrible experiences in the ER as a psychiatric patient because nobody could really understand what a panic attack was, what panic disorder was, what conversion disorder was. And I was treated quite horribly, actually. There were some doctors that were very, very kind, but of course there were others that were not. And I still remember those doctors to this day. And I highly, highly advocate for any crisis center. I wish I had learned earlier on during all of my panic disorder and things like that, that we actually have a crisis team that works in the hospital. That if there is an actual medical emergency that is more metabolic issues, they will send you straight to the ER to be seen. But for patients who don't know what's going on, like, we really need to be compassionate and help them through these things. And we really need to learn more about these mental health disorders so that we can educate our patients, so that we can educate those around us if you're not a healthcare provider, things like that. So keep in mind, pseudo-seizures are real. They happen. They're just like epileptic seizures. They're just different in origin of the cause, which is psychogenic versus neurogenic. And so, yep, give someone a hug today and let me know if you have any questions about pseudo-seizures. I've experienced it. I've been through it. So if you have, I hope that you're seeking help and the treatment that you need. And what's cool about the treatment is that once you figure out, okay, this is a non-epileptic psychogenic seizure, then you kind of know, okay, we need to treat this in a different way. There's different medications, whether that be antidepressants or whether that be seeking counseling or therapy. Getting to the bottom of that cause is a treatment that you need versus, anti-seizure medications. And especially because you don't want to be, CNS suppressant medications are so addictive. It was hard for me to get off of them because for me, they were life-saving. They were the only things that could get my body to calm down, to be okay. And so trying to get off of those and seeking better treatment options for you from your doctor, from your psychiatrist, whoever it be. Once you get that right treatment plan going, you're going to be rocking it. And I know I've lived through it, so hit me up if you have any questions, and I'll do my best to help you.